So last talk of the day, follow-up after bariatric surgery. Again, same disclosures as I mentioned before. And again, what you've seen, has been this dramatic growth in the prevalence of obesity over the last few decades. And unfortunately, this trend is not decreasing. I think that's the key message here. We're at close to 40% of adult Americans being obese or having a BMI greater than 30. The pediatric data, I think, is even scarier for what's to come. But even the predictions now are looking at roughly 1 in 2 adult Americans being obese. But if you look at some of the other higher BMI categories, those numbers are striking as well. Roughly 24% of adult Americans having a BMI greater than 35. Again, in many states, this number will be much higher than 25. So with that, we've been fortunate to have a lot of development in this field of really developing state-of-the-art modalities for the treatment of obesity. We've got state-of-the-art lifestyle, newer medications are continuing to come, especially the data behind semaglutide is just quite impressive. We just heard about endoscopic approaches, and then there are bariatric approaches as well. Dr. Kellogg did a great job of kind of describing these procedures, the restrictive plus metabolic when we talk about the Roux-en-Y gastric bypass, and then malabsorptive, which also continues to change. So it becomes quite prevalent as we move forward, and it becomes important for us all to be able to manage patients after bariatric surgery. But I'll start with a question here just to make sure that there's retention from previous talks. What type of bariatric surgery has increased the most in prevalence in the last few years? Gastric band, sleeve gastrectomy, Roux-en-Y gastric bypass, duodenal switch, or none of those options? I'll start polling, and I'm hoping to get into the 90% range. Close it there, and oh, excellent, 91%. Perfect, and here's the data that Dr. Kellogg was talking about. You can see what a dramatic shift we've had in the last decade of the sleeve gastrectomy, really rising as a standalone procedure with some of the other procedures nationwide going down in prevalence. But again, the number of procedures also continues to increase, and especially when we talk about over the next decade, with a quarter of adult Americans having a BMI of 25%, the prevalence will only increase because more and more will meet the indications set forth by most insurance plans.